Good morning. Today we'll be talking about hypertension and its effects on life. Hypertension, as everyone knows, is very common, particularly in Nigeria, and so it's important to talk about all these effects. Good morning, Dr. Majekodunmi and Dr. Adesina. It's a pleasure to have both of you on the program.
Good morning. Thanks for inviting me.
Good morning.
Now,
It's my
Dr.
pleasure to be
Majekodunmi,
here.
thank you. Dr. Majekodunmi, you're a cardiologist. I'm sure nobody's surprised to see you here, but Dr. Adesina as a psychiatrist, everybody wants to know what he's doing here. But we'll discover that later. Dr. Majekodunmi, can you
Yes.
first start off by telling us what is hypertension? What's the difference between hypertension and high blood pressure?
Okay. So again, thanks for having me. Hypertension is essentially the pressure at which blood is flowing through the cardiovascular system, basically through the body. Because in order for a fluid to move from one part of the body to another, there needs to be a pressure difference between two sides. I hope I'm not getting too technical with that. And there's a normal pressure by which the fluid is supposed to flow within the body. And once that pressure becomes higher, that is what we call hypertension, which we also call high blood pressure. So essentially, they're the same thing. The reason why we're discussing this today is because hypertension is probably the number one risk factor for death, worldwide. And it's a very important topic, and I think it's very appropriate to discussing it this morning.
Wow, so it's actually worldwide. I actually thought it was worse than us Africans. But can you talk to us about what the risks are? How likely am I or the person sitting next to me to have high blood pressure as a Nigerian?
So that's a very good question. And the risks are actually really, really high. So there are statistics that exist which say that 1 in 2 adult Nigerians will suffer from high blood pressure. Just think on that for a moment. 1 in 2, that's half. And I actually think while our data can sometimes be questioned, just anecdotally, in my experience in my clinics, that is probably true. I find it remarkable when I see an adult Nigerian who does not have high blood pressure. It's actually, it's relatively rare. Worldwide, the risk is quite high, probably about 35 to 40%, I think, in the data you get from the UK and the US, for example. And this comes to millions and millions of people. So conservatively, you could say, up to 50, 60 million Nigerians suffer from this and many more worldwide. It is really an epidemic and a catastrophe that is not coming, it's already upon us. The problems we see from hypertension, from renal failure, to heart attacks, to strokes, to dissections, to early death from aneurysms. It's just incredible. And I probably see a lot of this because I'm a cardiologist. And of course, quite a number of these patients come to me. But the consequences of poorly treated or untreated hypertension are absolutely devastating, both economically, emotionally, psychologically, financially, in all realms. The impact of untreated or poorly controlled hypertension, the consequences are very, very serious.
Okay, so but why? I mean, why is it so many? Why are we so prone to it? Why is the impact so great in us?
So there are two answers to that question. The first is there does seem to be something in our genetics as Africans that predisposes us to high blood pressure. And there's some research to suggest that the way in which we handle salt, so all human beings have to handle salt, is primarily excreted through the kidneys, but there is some research to suggest that the way we as Africans genetically handle salt is impaired to some extent, and that makes us more prone to developing high blood pressure and the consequences of high blood pressure. In terms of other reasons why this may be, this would include our diet. So as time has gone by, our diets have become progressively more laden in salt. So you can think about a lot of the fast food joints. If you think about all the fried foods that people eat, whether it's chips or chicken or other things, they're all very, very high in salt. A lot of fast foods like noodles and things like that, instant ready meals, again, are very highly laden with salt. And almost everything we eat has a very high salt content. And this really predisposes people who already have a problem handling salt to have more problems in handling salt. And once we have a lot of salt in our system, we hold on to water, it increases the pressure in our blood vessels, and that predisposes to hypertension. The fact is we're also more sedentary than we used to be many, many years ago, in the sense of not as much exercise. People are sitting down by their desks, working on computers, they're not exercising, they're not outside running around, even as young people. And all of these things leads to obesity and overweight, and being overweight, again, increases the risk of having hypertension.
Is there anything else?
Yes, absolutely. So I know I've focused a lot on some of the medical and sort of physiological aspects of hypertension, but there are psychological aspects to it as well. It is very well known that stress is a strong precipitant of hypertension. Those people that are called type A personalities.
Yeah, we're actually going to. So you don't tell us all about that. That's what we've got Dr. Adesina on for that. So we'll let him tell us all about that. Yeah. So anything more you want to talk about?
So at least for the risk factors for hypertension, those are the main things. And I'll let Dr. Adesina talk more about the psychological aspects of the causes of hypertension, because they are certainly very relevant.
Yes, they are. But I wanted you, before you finished on the medical aspects of things, to talk about diagnosis.
Okay.
How does a person know that they have hypertension? Because we haven't really talked a bit about the symptoms. What are the symptoms? Are there any? And how, should a person know that they need to get checked?
So generally speaking, one of the reasons why hypertension is such a public health hazard is it most of the time has no symptoms whatsoever. And that is really the biggest problem, because there's no driver, there's nothing that drives people to go and have their blood pressure checked. And that is why worldwide we have created multiple points where we want people to be able to access their blood pressure. Even if you're getting checked for malaria, somebody's going to check your blood pressure. If you're going to the dentist, somebody's going to check your blood pressure. And the reason why we do that is because we know that there are probably 95% of patients with hypertension have no idea they have high blood pressure unless somebody checks it and records you having records those high pressures. The way we actually make the diagnosis is if we see that your blood pressure is high, and high is defined as usually more than 130/80, what we'd normally be advised to do is to come back on a different day and a different time and check it again and see if it's consistently high on multiple days. Then you're defined as having high blood pressure, and then you need to take medication to bring it down. Now, a few people do have symptoms of high blood pressure. And so if you're an adult, usually above the age of 30 or 35, and you have these symptoms, again, it's worth having your blood pressure checked. Persistent headaches that don't go away are a symptom of high blood pressure. Nosebleeds, recurrent nosebleeds can be a symptom of high blood pressure. Blurred vision, dizziness, all these can be symptoms of high blood pressure. You can also get things like some chest pain and shortness of breath, but those are actually quite rare. But the key thing I would like the audience to really take away is, for the vast majority of people, you feel absolutely nothing. I mean, Pamela, you and I have been on medical outreaches, and we've seen people who are walking around totally feeling fine, just coming to the outreach just to get checked, and their blood pressure is like 200/140. Yeah. Oh, just ridiculous. You wonder how these people are walking around,
time bomb.
Still functioning completely, but they have no symptoms, no headache, no nothing, feel completely fine. So the only way to know is to get your blood pressure checked and do it regularly.
Yes. And the amazing thing is they say, XYZ slumped. That's what they say. What happened to them? They don't know. Nothing was wrong with them. What do you mean nothing was wrong with them? They had high blood pressure. That's what they call slumping disease. Because the people think it's actually a condition. People slumping.
Yes.
It's actually high blood pressure. Correct. Undetected or untreated high blood pressure that causes that. So I think people need to know about it and the importance of checking themselves. Now, one of the things that we've also noticed is the fact that high blood pressure tends to occur in very young people with hypertension in the family. But I don't know, well, we might talk about it later, but how important is it to really start checking early?
I think it's almost really it's never too early to start checking. I mean, from a medical standpoint, we would say the highest risk of the people having high blood pressure is above the age of 30, but we've seen it in younger patients. It's never too early. And as I said, we've created multiple points at which people should be checking their blood pressure. You go to the dentist, you go to, you go to family planning, you go to antenatal clinic, wherever. Someone is almost always checking. But you walk into a pharmacy, most pharmacies, here, even here in Lagos, they'll have a facility for you to just check your blood pressure. There's multiple ways, and you should check it multiple times a year. It's not that you check it once in the year and you say, oh, it's fine, and you don't have to check it again for the next 2 years. That's not true. Things can change very quickly. So the best thing is, you check it, if it's normal, check it again in 2-3 months, check it again routinely when you remember and you have the opportunity. Just check it again and make sure, because it's a simple thing to start treatment. The diagnosis is very easy, just a blood pressure check, and the treatment for it is widely available and is very effective.
Thank you. And I think the thing to also throw in is that a number of people have a spouse with blood pressure. They even have those blood pressure machines at home and they don't use them. If your spouse has high blood pressure, please check yourself. Yeah,
Absolutely.
check your own. It takes nothing.
You made a very good point earlier about family history. So I use that a lot in my clinic. So when I see people who are not sure whether they have high blood pressure or not, I will always ask them, and because sometimes it's maybe been elevated once or twice and they're not sure. But once they tell me that, oh, both my parents are hypertensive and my older sister is hypertensive and my older brother is hypertensive, then it's clear to me that clearly you have the gene. The blood pressure I'm seeing in you is not an accident. It's not because of something else. It's because you're prone to it. You're now exhibiting it. We need to start treating it. So the family history is very important. So if anybody is listening, someone in your family, a brother or a sister, or your parents may unfortunately have it, you need to have that enhanced awareness and check your own blood pressure to make sure that if it is getting elevated, you need to start treatment early.
Thank you very much. Thank you, Dr. Adesina, for coming on the program. It's really nice to have you here to talk to us. And I'm sure a lot of people are thinking, what is a psychiatrist doing on this program about hypertension? But I think Dr. Majekodunmi alluded to it earlier when he talked about stress. And so can you tell us some of the psychological effects about hypertension and what causes hypertension and all about the psychology around hypertension in life?
Thank you very much for having me. Stress can be defined as a state of emotions, in response to changes that demand a change, in response to challenges rather that demand a change. Stress is like the confluence points, between environmental factors, psychological factors, and hypertension. What I mean by this is that when we talk about stress, we talk about emotional responses that drag along some physiological responses. In terms of emotional responses, we talk about our feelings, responses to challenges, events around us. And you will agree with me that the world at the moment is a bit, challenging for every one of us. In terms of talking about finances, talking about insecurity issues, talking about, loss of employment, talking about different challenges here and there. So all these things put together generate emotions, in the individuals that are affected. And when the emotions are generated, they drag along certain responses, like increase in the heart rate, increase in the amount of work that the heart does, in trying to respond to these emotions. And when all these things put together can actually lead to persistent elevation in the blood pressure of an individual. And it gets worse if the factors that are precipitating these emotions, these stressful emotions, persist. Then it means the blood pressure of the individual, the heart rate, the blood pressure also continues to be on the high side. And when it continues to be on the high side like that, the body can lose the ability to further control the blood pressure, and eventually it leads to hypertension.
That is quite a cycle, and also very worrying, because when you look at today's world. I mean, today's world is highly, highly stressful. I mean, what with, the cost of living crisis, the issues with diesel today, electricity tomorrow, it's just never ending. And then you add what Dr. Majekodunmi said about, the issues we have genetically. That, is it really surprising that 1 in 2 Nigerians has high blood pressure? So what can we do about it? Is what I'd like to know. I mean, what are the things that, I mean, somebody listening to this program and saying, you know what, this is not my portion, but it's not enough to say it is not my portion. How can they make sure? Are there things they can do to prevent having hypertension? Is there a way they can manage their stress to be able to live a better, healthier, and happier life?
Yeah, there are things that can be done to manage stress, and by so doing, reducing the risk of hypertension and some other consequent complications. When we talk about managing stress, it comes from, it starts with positively evaluating events. There's a saying that it's not the events that happen around us that matter. What matters is how we react or respond to those events. And our reaction to events, is determined by how we appraise the events. For example, 2 people can be in a room, and they are maybe attacked by armed robbers, take all their possessions. One of them can appraise the situation like, oh my God, I'm finished, I'm done. They've taken everything I have in life. How am I going to bounce back? The other person can appraise the events like, oh, this is really challenging. There must be a reason why God allowed this to happen. I'm sure I will definitely bounce back. The same events, different appraisers, different evaluations of the events. Definitely their reactions and their emotional reactions will be different too. And the difference in the emotional reactions will determine the health outcome of both of them. So someone that has a more positive appraiser will more likely have, positive emotions, will more likely have better coping strategies, to deal with the situation and move on with life. While the other person that has a negative appraiser will more likely have, will likely be weighed down by the negative emotions and will find it difficult, to move on with life. Another important thing is sharing our feelings, sharing our problems, sharing our challenges, looking for, right set of people to share our problems with, people that sharing your problems with them means, a kind of a reduction in the severity of the problem, not people that will compound the problem at the end of the day. Also of importance is when we talk about coping skills and coping strategies, taking up proper and adaptive coping strategies, like, lifestyle modification. When you are stressed, when you feel stressed up, you do positive things like taking regular exercise, reaching out for help, going for therapy sessions. Those are adaptive coping skills and strategies. And avoiding the maladaptive ones. The maladaptive ones include coping with alcohol, coping with other street drugs like cigarettes, cannabis, and all sorts of things. These are things that we see, in everyday clinical practice, how people cope with stress. And these things further damage the health of these individuals. So, and like Dr. Majekodunmi said, a lot of people carry the gene of hypertension, because everybody looking into our families, we don't need to look far before you find someone that has hypertension. So the genes are already there. The stressors are there. It's our appraisal of the events and how we cope going forward, that will determine what happens, as regards developing hypertension and other the consequent complications that come with it.
Thank you. Dr. Majekodunmi, are there any other factors that you want to throw in for people listening to say how we can prevent hypertension and how we can, or even if we have it, from making it worse?
So, I mean, I really like the point that Dr. Ismail mentioned, which was, alcohol, for example, which is a way of some people coping with stress. And it's been very well documented that people who have an increased alcohol intake or abuse of alcohol makes treating their blood pressure, it makes treating their blood pressure much more difficult. So I think it's really important to highlight that, you know, alcohol and increased alcohol intake, you know, not only can cause your blood pressure to be elevated, but can actually make control of your blood pressure much more difficult. And you need many more drugs to control it. I also really wanted to emphasize the issue about obesity, because I know that that is another epidemic that we're dealing with at the moment. And we know that obesity can predispose to high blood pressure. And it's really important that people take all the steps that they can to keep their weight under control by eating right, you know, reducing the salt, the fat in their diet, the sugar in their diet, most importantly, and undertaking regular physical exercise to try to keep their weight under control. I think these are things that can also help to control their blood pressure. And then, of course, we're going to come to talk about treatment, which is really important, that if you do have it, what is the treatment for high blood pressure? The first thing I will mention that I want everyone to take away, because I don't want it to get lost, is once you are properly diagnosed with high blood pressure, the treatment is for life. And I really think it's important, it's so important, I really want to repeat that once you are diagnosed with high blood pressure, for the vast majority of people, you are going to take your tablets forever. I know a lot of people don't want to hear that in our environment. People talk about, it's not my portion. I'll take it for 3 months and I'll reevaluate whether I need it. This is not correct. I have had innumerable patients try this experiment. It does not work. They will take the tablets for 3 months, for 6 months, they'll stop. And then, you know, after a while, they'll come back and, oh, lo and behold, the blood pressure has gone up again. It is lifelong treatment. And you have to take your medication regularly, consistently. You just have to do it. And that's the only way you can get your blood pressure under control. Hopefully to a blood pressure less than 130/80 is what we want everyone's blood pressure to be. If it's lower than that, that's fine. The only time that it's too low, when patients start to panic, is when your blood pressure is less than 100/80. Once it's over 100, just continue to take your tablets consistently to reduce the risk of all the bad things that untreated or poorly controlled hypertension can do.
Dr. Adesina, I need to ask you a question, because the 2 questions are coming up. The first is, why do we as Nigerians not want to take medication for life? I mean, Dr. Majekodunmi has spoken about, you know, the fact that people don't want to take it. They always stop taking it. And this is not 1 or 2 people. This is a lot of people. Educated, uneducated is irrelevant. They all stop and they think, oh no, let's see if I can get away with it. Some of them have strokes in the interim. Some of them, you know, all sorts of things. Why is that?
Yeah, there's a cultural perception and a cultural and somewhat religious perception that sees receiving orthodox treatment for a long time as a problem among Africans. We've over the years tried to spiritualize a lot of things. And part of the things we've spiritualized is not having the need to receive treatment. People can cope easily with receiving treatment for a few days, but when it comes to the reality of having to receive the treatment for a long time, that's when a lot of things come into play, rebuking it, praying to God to put the doctors to shame, and stuff like that. But the truth of the matter is that we need to understand that the knowledge that the doctors are using was, like I do tell my clients, this knowledge is from God. And God loved us so much. That's why he gave us access to all this knowledge, to better the lives of humans. So a lot of advocacy needs to go into letting our people understand the fact that taking medications for a long time is not a problem, it's not a disease, and should not be seen as that. It's a way of helping out and providing solution to the challenges that anybody could be facing. So I think that's a very
unfortunately, time is point. No, I mean, time is really fast spent. I really wanted to talk a bit about stigma and some of the reasons why people, one of the things is, and I know this is really difficult. I don't know how I'm going to squeeze it in, but very quickly, can you tell us why is it that some people don't tell their children about high blood pressure? They're still hiding it. Like if hypertension is so common, and yet they hide it. They don't tell each other. They don't tell their family members, so people don't even know they're at risk.
Yeah, Pamela, I'm just going to interject because I just think this is an important point about why people sometimes want to stop taking medication. I'll say that one of the things I've noticed that men in particular sometimes are terrified about some of the side effects of blood pressure medication, namely erectile dysfunction. And this really prevents a lot of men, or stops a lot of men from wanting to take medication. And I just wanted to take this opportunity to reassure a lot of them that most of the medication does not cause erectile dysfunction. We can treat erectile dysfunction if it does occur. We can stop the offending drug and change it to something else. So do not let the fear of potential erectile dysfunction stop you from taking your blood pressure medication. It is something that is very easily managed in conjunction with your cardiologist or family physician. Please do not let that stop you from taking your medication. I thought that was an important point to bring up, Emma.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.